So where does inflammation fit into all this? So in with respect to diabetes, well, we're talking about type 2. So my audience knows I'm type 1 diabetes. That's a whole different sort of beast. But so we're talking about type 2 diabetes here, and also all these chronic pains, lower back pain, migraines, or general probably joint pains, right? So where does inflammation fit into this picture?
So there's a couple of pathways. And this is even valid for type 1 diabetics eventually. And because most type 1 diabetics are treated with insulin, and insulin is a pathologic instrument if used in the wrong way. If I take a healthy person and I make them a type 1 diabetic, they become very thin and they lose almost all of their weight very quickly because insulin doesn't work in the way that we think. Insulin historically has been thought, oh, insulin allows glucose to get into the cell. That's only partly true. Insulin actually has two other factors. Insulin allows glucose to get into the cell so that it evacuates an excessive amount of glucose from the bloodstream, because excessive glucose creates an oxidation reaction and causes rusting of cellular material. But the second thing insulin does is it also is a growth factor. It's a potent growth factor. Now, back to the first thing, insulin allows glucose to enter the cell and it shunts the glucose into first glycogen reserve. And once the glycogen reserves are topped off, the rest of it is stored as fat. And we have an unlimited storage of fat. We only can store about 2,000 kilocalories of glycogen in our liver bed and this various other areas, but we have nearly unlimited fat storage. And the problem is that we have a hormone called leptin. And when we eat food, the fat releases leptin. And that tells our brain, our hypothalamus, that, hey, we're full, stop eating, stop eating this food. The problem is that the more fat that we have, the more leptin we release, and we become leptin resistant. So our brain no longer recognizes that we're full. So that would be okay, except that leptin is also one of the strongest, most potent inflammatory cytokines that we have. And hyperleptinemia causes severe inflammation. And it's the leptin from your visceral fat that causes systemic metabolic inflammation. Now, at the same time, you've got this issue where you exposed your mitochondria to too much glucose because you were hyperinsulinemic, and that gums up the mitochondria. And the mitochondrial inner shell starts to become dysfunctional, and your active oxidase systems fail. And so eventually you become insulin resistant because you've got too much insulin. That's why when I take a type 1 diabetic and give them a bunch of insulin, the first thing that happens is, one, they restore. They're not type, they're still type 1 diabetic, but they start to thrive. And then they start to over thrive because they start to get fat. They store too much viscerogenic fat. Well, a type 2 diabetic starts there. They're eating too much food and they have hyperinsulinemia, and eventually they have a problem in that they have systemic metabolic inflammation. They continue to gain the weight, and eventually they gain so much weight that it decreases the perfusion of what's going into their pancreas. And there's a paracrine effect from glucagon to insulin from beta cell to alpha cell in the pancreas, and they stop producing insulin. And so that's when you transition into adult onset or LADA, or type 2 diabetes, that becomes totally insulin dependent when they stop producing any insulin at all. And then there's a secondary effect that the local macrophages start to activate, and they cause issues. Now, I'm going to give you another part of this puzzle, and that is that fat actually, if you go back teleologically, if you go back and say, hey, what is fat? What was primitive fat? What was its intent? Well, one, it was there to store energy for a time period when you had to go from place to place, and you need to store energy and you couldn't carry it with you. So you carried it in you. You weren't going to put a bison on your back, but you could store up 30 pounds of extra fat, and they would carry you for, 150, 250, 300 miles, 500 miles. And you could starve for the next 500 miles and be okay, as long as you got some water. the long part of it is teleologically, that fat that we have in our viscera starts off back in the Drosophila, back in the fruit fly, and it's a 3-component system. It's called a fat body. The fat body contains with it the fat, an immune system, and a liver function system. The immune system is where most of our macrophages come from. And so we have these macrophages that are first alarm systems that are associated with our fat, and they also light up as our fat gets thicker and we get these cytokines kicking in. The cytokines cause the activation of the nascent macrophages. So it's a complicated mess, but it's interrelated. Once you understand that the fat is not just fat, the fat is an organ, and the organ used to be immune organ, fat organ, and liver organ, then you realize where we are now as humans that don't need to carry 30 or 40 pounds of extra fat around to go from one hunting area to another. And so now when we carry this extra fat, we never get rid of it. And now when we have activation of our fat, we have terrible immune responses with systemic inflammation. That's how I ended up here.